sartorius. So we're looking at sartorius.
Sartorius. ASIS.
So find the
SIS.
ASIS.
Yeah. So we're coming down to the pes anterannus insertion.
Pens anterannus insersion in medial knee.
Yeah. The muscle runs down in the long band.
And there. Okay. Next one is your TFL, tensor fascia lata.
Okay, so we're looking on the outside here. It's a small muscle located here.
You'll be able to see it better if you flex the hip
Yeah,
as well. So
flex the hip.
bring it up. Can you see it?
Yeah, it's in there.
Flex the hip.
Little triangle there.
And triangle.
Comes down into the IT tract, all the way down.
And the insertion of that is the let's see. Right, moving on to rectus femoris.
Okay, the same anterior inferior iliac spine.
Yep, anterior inferior.
Okay, coming down, up over,
To the main bulk.
over the top of the patella to the tibial tuberosity.
Tibial tuberosity. Okay, and now moving on to the hamstring group origins. Name this and go.
Nice and tight here, ischial tuberosity.
Okay.
Coming down. All the way down, so bicep femoris is the head of fibula. And the semitendinosus comes down into pes anterrinus on the medial side. And the membranosus comes just behind posterior tibia.
Okay. So we move on to gluteus maximus. There's the maximus.
So coming from the outer ilium. Yeah, you can feel. And they're coming down off into the IT tract. So big.
Okay. Now looking at glute medius.
So again, slightly distal, coming down. Coming across outer ilium again.
Now to the piriformis.
Piriformis, best way to do this. Greater trochanter. Okay. Follow your way across. So we're looking centrally. Piriformis in there.
That's going to be on there. Okay. Then moving on to the abductors. So abductor longus.
Okay. Spin yourself over. Might be better, possibly. Get the full package. So coming down.
That's tight as well.
I've zoomed
Yeah.
in.
So coming down in here.
I'll add £5.
Running with the linea spira coming down.
Okay. Then moving on to the last couple, which is abductor magnus. That one there.
Is it the longest or the magnus that comes down?
All the way down magnus.
Magnus.
It's attached all the way down.
Yeah. Longus and brevis are quite high.
Yeah.
About here. Yeah.
Inside laying with the top hip flex, locate the ischial tuberosity. Ask your partner to abduct the hip slightly, shifting anterior load to tendon of the abductor longus. Slide off the tendon posteriorly to palpate the wide tendon of the abductor magnus.
You can feel that.
Tight as a bag.
Yeah.
As it stretches to the iliac tuberosity, Follow the fibulus distal. However, it is difficult to differentiate between these and those of the semimembranosus.
Wow.
That's tight. Yeah.
Definitely can. Yeah.
Tight, and then you come up into the medial aspect, going along the femur, find the attachment, because it runs pretty much and attaches
Yeah.
all the way down,
Ends about here.
and then down towards the knee. Okay,
The Magnus.
so looking at the next is the pectineus, which is
Pectineus. We look for hip flexion as well.
with the hip slightly flexed and
Yeah.
lateral rotated. Place the flat of your hand on the middle of the medial thigh and ask your partner to abduct the hip slightly.
Abduct the hips slightly.
Locate the prominent tendon of the abductor longus. Slide off the tendon laterally towards the ASIS. Slowly sink into the belly of the pectoralis. You should be inferior to the supraramus of the pubis, and then ask your partner to alternately abduct and relax the hip to flex the fibers of the pectoris correctly.
Yeah. Is that right?
I think it's probably lower down
No.
the picture.
Not if you look at the hip.
Oh yeah, actually, yeah, the
Hip
lime in the
starts
hip.
there.
Yeah,
So we're looking here.
yeah, that's about it. And then finally, the psoas major,
Psoas major.
which is pretty
comes
much
down.
easy to find.
Yeah, it's from T12, L5 coming down,
Down.
Tickles.
and over. Okay.
In supine with the hip slightly flexed and laterally rotated, support their thigh by placing your thigh underneath. Place your fingers top half away between the navel and the ASIS. Slowly compress your fingertips into the abdomen as your partner exhales. To check you are palpating the psoas major and not the surrounding tissue, ask your partner to flex the hip slightly so you feel a definite solid contraction. Yep.
That's it. Yeah.